Is it fair to say, based on what I've heard, that the correctional facilities in this country have become kind of the de facto psychiatric crisis centers, centers of last resort in this country? Is that fair?
Yeah, 100%.
Wow.
And unfortunately, it's only getting bigger. So what's happening is you're getting increasing mental health programs within the correctional facility rather than having those in the centers where they should be.
And we don't raise taxes in this country, so what do? They take the money from the existing community system to pay for this. So over the last 10 years in the United States, you've seen a leveling off of the number of people going into jail, but not for people with serious mental illnesses. That's going up like this.
But you mentioned that they have become the crisis center, but in fact, in a number of cities, San Antonio, Albuquerque, we have what's called the crisis center. And it is, again, a collaboration with law enforcement and the medical system. That is a place where the officers will bring individuals with a mental illness to be treated.
That's what we should be doing, but it's only in a minority of communities.
But that is the way to do it.
That is the route, absolutely.
Not many are doing it, but you're right. Criminal justice institutions have become the de facto mental health institutions, and there is an issue there because as the criminal justice institutions begin treating those with mental illness better, it's almost like more individuals with mental illness keep going there. And so do they not contend with the issue that they're dealing with and push them back out to a community that they know doesn't have adequate resources? Or do they work hand in hand with the community to build up those resources?
It would seem odd to me that a community, unless we change the perception, the community would say, I'm going to work with the prisons, I'm going to work with the jails. It seems more palatable to say, I want to work with the hospital.
It would, but what we've seen is all the people that used to work in mental health in the community are now moving, they're employees of correctional facilities because that's where the mental health treatment is going towards.
And it's ridiculous. And a lot of it has to do with the parity laws not being followed and not putting the same amount of dollars into mental health as they do for primary health. You know, the insurance industry has done a terrible job making sure that this population's getting the service that they need, and the states do not fund these at the same level as primary health.
There was an editorial from one of my colleagues at Presbyterian, it was back before we changed our name, the New York Psychiatric Institute, who said, you know, it's with mental illness not being recognized as a real quote-unquote disease, with insurance companies, and he didn't name any names, limiting the number of therapeutic visits to 5,
right,
which is ridiculous.
And it's arbitrary.
It's an arbitrary. That we've condemned a cohort of our population to do exactly what we're seeing here today. That was prescient. That was over 10 years ago.
And that's exactly what's happening.
And it continues.
Yes,
and we know
worse.
that mental health, and I could speak to this, mental health courts work very well. Have them have treatment options versus going into jails or prisons, but most of the communities we see don't offer these mental health courts or substance abuse programs through court.
You know, it's this perfect storm. It didn't happen overnight. It got this way through a combination of things. We closed most of the hospital beds, psychiatric hospital beds. We went from about 550,000 to about 32,000 today. We went to the war on drugs. We went to the war on crime. We instituted sentencing guidelines. And we really pushed this population from hospitals to the street and into the correctional
Okay,
setting.
let's